patient really close to you so that you're not leaning over with bad body mechanics, okay? But what I like is to be on this side of them, sitting next to them. And then what I'm going to do here is I'm going to make my way. I'm going to give her a little push back, and I'm going to make my way under her scapula, okay? So I'm pushing her into that posterior tilt that I want, okay? Which is winging up her scapula for me, and then I can hold on to it, okay? So can I borrow this? Usually I have gloves on for this because are there gloves back there?
There's some over there on the table.
Can someone grab me some? Because the traction of the glove helps me to hold on better to, thank you, to her scapula. The other thing here is you really want to have your nails really short so that they don't feel your nails. So I'm going to give her a little posterior glide. You see how I'm trying? I'm going to take control of that whole arm. And now I'm going to lift her scapula. I'm getting under it. And if she's a little tight, I'm just going to wait until I can really get a nice grip and she starts to let go. Then you see my thumb here? I'm going to go up and I'm going to grab that spine of the scapula. And as I'm pushing this direction with the front hand, I'm pulling into upward rotation. I'm also, as she's starting to let go, what I can do is I can create thoracic rotation as I pull out. Do you see it? So I'm creating this upward rotation by pulling, posterior tilt, upward rotate, and traction through the scapula. And then I let her just go with it. Let their body pull into the rotation. Okay? So it just adds another element of restoring that posterior tilt at the same time that you're doing a little bit of this upward rotation. And it's like I just kind of work my way in there. And if it's really tight, I just wait for her to start letting go. If she doesn't let go, some of you might find there's no gap. You can't get under there. That person might need some soft tissue work on levator, on pec first, on rhomboids. They might need some encouragement to let go. And that's why I do the ribs first, because she already is a little let go from the rib mobs. So I always start with rib cage, go to T-spine, go to scapula, okay? So it's hand in front, fingers underneath, thumb trying to reach that upward border, push a little, pull a little back. Do you see it? The posterior tilt, upward rotate, and then just kind of go with it. Try to get under there. That levator that's right here is usually pretty hypertonic. So massage it a little bit, okay? Get in there and try to mobilize it, okay? If you can't needle it. Or do this first and then needle second, whatever's left, okay? But it's right here. It's a pretty big muscle. So it's usually pretty hypertonic. Okay, then you could do your superior, inferior. You could do a straight distraction. But it's fine to be on this side of her. But if you're trying to create rotation and a posterior tilt, you might want to be sitting with them right here. Okay, now I know that picture for the demo, I'm behind, you see? But on the left picture, I'm doing just what I am now. I'm on the same side of the patient's scapula, okay? So we want to create the posterior tilt, little distraction, a little upward rotation, and then maybe keep going to create a little rotation in her trunk. So it's just another way, just a little more advanced than just going up and then up and down. Okay? All right, click that slide for me. Okay, SC joint on your back. So, very, very simple. SC joint is, if it's restricted, again, you're gonna give it a little push. You're gonna be on top, and you're gonna give it a little glide. And you're gonna check her left. And if her left moves a little bit better, you're gonna maybe mobilize her right side. So you come just on top, again, thumb over thumb or thumb next to thumb, and you're giving her an inferior glide. Now it's careful to not push into the throat. You wanna just kinda hook onto the SC joint. It'll be a little tender, and you're just trying to encourage it to go that way because you know you want the arm to go up. Click the slide. Posterior glide. You should come right on top of the SC joint and the clavicle. Thumb over thumb, pushing just straight down. Okay? Again, school of thought, whether it goes, helps with forward or backward, it's really up to you to decide that. But if you notice there is a restriction, you just give her a little 30-second glide for the posterior glide of the SC joint. Keep it simple here, okay? Next slide. Okay, lateral distraction. I'm gonna come back over here. This is a joint play. It's a courtesy traction. You hug under the axilla, you anchor your forearm to them to create that motion. Okay, so I'm right there, I brace against her, and I give her a little lateral traction. If the glenohumeral joint is restricted. If by now that you cleared T-spine, ribcage, SC, scapulothoracic, and you have full range of motion, you should stop there. Okay, if you don't have full range of motion, whether it's extension, external rotation, then pick the joint mobilization that facilitates that movement. You can start with a courtesy lateral distraction, an inferior distraction, which would be I anchor into her axilla and pull. I even kind of like sit back with my body weight. If you need an inferior glide, here's your movement, okay? If you need a posterior glide, I'm gonna ask her to come to the edge of the table, and I will engage the posterior glide of her glenohumeral joint. I could also do that, stabilize her scapula, come cross body, here's my push. Posterior glide. Or I could use something, a wedge, to block the scapula. But there's a posterior glide. Okay? That might be a little impingy for her. So you might want to just do it very traditionally, like this. If we have her flip onto her belly, and I'm going to have you come this way with your arm, I would need a towel roll or a wedge. You'll turn your head the other way. I will block her shoulder to create the anterior glide this way. If we don't block her or really stabilize, we're just going to kind of be bouncing into the joint, okay? So you'll firmly hold, go into her range, and then mobilize her. 30 seconds, 45 seconds, whatever your preference is. Next slide. Okay, posterior we showed, okay, got it?